Good evening, everyone. My name is Payal, and I welcome you all to We Talk Do You, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited, IIL, which was established by the National Dairy Development Board in the year 1982 as its unit, and later registered as a company in the year 1999. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine that was to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out the first Vero cell culture rabies vaccine in the year 2000. Subsequently, Human Biologicals Institute launched other vaccines, and currently we are the major player in human vaccines and leader in anti-rabies vaccine segment with presence in around 50 countries. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley, Human Biologicals Institute has also forayed into the market of clinically proven wellness products and infertility range of hormones. Human Biologicals Institute's vision is to shape global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We truly believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. We're very proud to share about our green initiative. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly pack for our flagship brands. Not just this, as an organization, we truly believe in our corporate social responsibilities. Either it is adoption of government schools, where IIL has adopted two government schools in vicinity of Kakapatla, where IIL is providing infrastructure facility, including help in the midday meal program, or in our association with NDDB through our gift meal program. Many children are benefited from Telangana and Tamil Nadu belt. We're working towards a rabies-free nation. To start with, we have started working with Thiruvananthapuram in association with FIAPO, Federation of Indian Animal Protection Organizations. This was a few information about Human Biologicals Institute. For more information, you can also log on to www.indimin.com. Well, today, before we begin the session about a very important topic, infertility in working women. Well, the day is not far when the issue infertility is going to become as common as type 2 diabetes in India. More so, it's becoming so common, and it's a leading cause, or I would say a rapidly increasing cause in the stress for working women because of the rotational shifts, night shifts, long working hours, and additional stress. It's becoming very rapid and it's increasing at an alarming rate in women of India. Well, stats says that 1 in 6 couples are struggling with infertility and would like to go and visit an infertility specialist for conceiving and for gaining the hope of parenthood. So, for discussing this particular very important topic, we have a very special guest with us today. Please welcome Dr. Sahana. Dr. Sahana KP is a consultant obstetrician and gynecologist at Vipra Women's Health Clinic, Vasavishwara Nagar, Bangalore. She is also a visiting consultant at Cardiac Hospital, Kangaroo Care Hospital, and Manipal Hospital in Yashwantpur. She has been responsible for providing the hope, smile in many couples and have helped many women experience the joy of motherhood. With this, it's a pleasure to welcome Dr. Sahana in We Talk Do You show today. Most welcome, Dr. Sahana, and thank you for joining us.
Thank you. Thank you, Dr. Pyle, for the warm introduction.
So, Dr. Sahana, without any further delay, I first would like to request you to help our viewers know, though I'm sure many of them would now know a bit about infertility, but it would be great to hear it from you. If you can give us some brief about what exactly is infertility and why everybody should be aware about it.
Okay. So, good evening to everybody. As we would know by now, actually, infertility is becoming a very common problem in the Indian population. Roughly around 1 in 6 couples are turning up in clinics and questioning as to why they're not able to conceive. The WHO defines infertility or primary infertility as when a couple is not able to achieve a pregnancy at the end of 1 year of regular unprotected intercourse. All right. So all the words in this have some meaning. One is the criteria they've taken of 1 year. So we wait for couples to try for 1 year without using any contraceptive method on a regular basis. And then if they have not conceived at the end of 1 year, we do evaluate them. Then, of course, there is primary and secondary. Primary is when they have not conceived at all, and secondary is where they have conceived once and maybe, have a long gap after that and they've not been able to conceive again. And that is when we take it as secondary infertility. Of late, we are seeing a rise in male infertility also. Earlier, we had more of female and then a marginally lesser number in male infertility. Around 40% used to be female, 30% attributed to male, and 10% would be combined, 10% would be unexplained infertility. Nowadays, we're seeing a rise in male infertility. So, almost equal percentages of male and female infertility is being seen. And of course, combined factors are there, around 10 to 15% of them. So usually, whenever a couple tries, we give them a time period of 1 year because in any particular cycle, for a woman to conceive or for a couple to conceive, the chances around only 15%, what we call as a fecundity. And that's why we wait for about 12 months before we can, label the patient as or the couple as infertile.
All right. Thank you so much. So now that you have given us a very interesting fact, there was a time when majority of the cases, infertility cases, were because of the female partner. But you have given a great insight to us that these days it's almost becoming equal. Both male and female counterpart are equally responsible for the couple to be infertile. So since today we are focusing our discussion on how the women of India, especially the working force strata of India, are at increasing risk for infertility. So considering that particular topic, Dr. Sahana, can you give us certain insights? What can be the probable causes of infertility, specifically in women, that everybody should know about?
See, in women, we roughly have about 7 to 8 causes that we have to rule out. Most common cause will be ovulatory dysfunction, where there is the regular ovulation is not occurring. It could be because of multiple causes, but that is the majority factor. Then, of course, we have the tubal factor, the fallopian tubes. If there is either some form of infection or there is a tubal block, they will have difficulty in conceiving. The major disease burden of endometriosis is there. A lot of women get diagnosed with endometriosis, and there they have some difficulty in conceiving and they may need assisted reproductive technology. And then, of course, we have smaller factors also, which may include even pelvic adhesions, they can be pelvic infections. All these cause a smaller fraction. So, the moment we are sure there is no ovulated dysfunction, then only we try to rule out the other factors. The main cause being that whether the woman is ovulating correctly and ovulating on time is what we always check for first.
So, considering, I mean, apart from these physiological and biological issues that can be a probable cause for infertility in women, there has been an increasing trend of handling life with a lot of stress,
Hmm.
and it has become an integral part of the workforce. So they have these days they have learned to live with it. So what do you have to say about it? How much do this factor known as stress is really important for everybody to understand that it can also lead to infertility? I would really love to hear it from you.
So, in case of majority of the working women, like when you say working, we are thinking more in terms of women who work long hours, office jobs, desk jobs where they're getting lesser time to move around or exercise. Those are the kind of thing, that sector of women is what we are thinking about. Because working woman is a very vast and a very vague term, because every woman is working all through the day and night, right? So,
Correct, correct.
so we are going to think more in terms of these women. So what we see is one is in all, in whatever, irrespective of whether they're stressed or not, the two main factors that play a role is age is one, and their ovarian reserve. So as the age goes up and as their working levels also go up, they want to rise in careers professionally. They don't want to give it up at certain stages, to take a break and conceive. So these factors we see very commonly these days. So as the age goes up, automatically, as we know by physiology, the ovarian reserve of the woman comes down. So along with that, if there is a factor of stress, that in turn has a negative impact on the egg quality. And these are the patients whom we very commonly see who come with irregular cycles. They are ending up gaining weight. There is a component of obesity. They're not able to get their regular exercise 30 to 60 minutes a day. We see a lot of other addictive habits in them, more tendency for alcohol consumption, more increased incidence of smoking in these women. These are all mechanisms they have taken to fight over the stress, which has a negative impact on their menstrual cycle, on their ovulatory function. So, in turn, this in turn causes them to take longer periods to conceive, and that is when they come with infertility. So stress has a major role in these women. So the moment they come to us and they tell us that they're not able to conceive, the first thing we ask is about their cycles, and the second thing we ask is about their lifestyle. So what are their working hours? When are they sleeping? Are they doing night shifts? Are they sitting for long hours at a desk? How is the work stress at their workplace? All these factors come into play. So many times we have seen the moment that stress is cut down, the moment the woman chooses to take a little off time for herself and start concentrating on her health, we see remarkable changes in all the hormonal profiles, in results at the end of the day. So stress that way is one of the most important factors, and I think that is the one that drives all the other factors into infertility,
Correct.
especially in this set of women.
Absolutely. Thank you so much, Dr. Sana. I think before we move to our next question for Dr. Sana, I would thank everybody who is joining us live today in the program, and I would request you all, if you have any sort of questions you want Dr. Sahana to answer, you can please put it in the comment section. We will get back to you all the questions, and Dr. Sahana would answer them by end of the discussion. And you can also, if you think this particular topic would be of interest and you can help somebody out there, do share this video with them. I'm sure they'll get a lot of insights from this discussion today. Now, Dr. Sahana, getting back to our discussion, so now you've mentioned that stress, first of all, can lead to many other problems that can further lead to infertility. So, when a particular couple comes to you and you see the issue with the women, and you start suggesting her, with the basic stuff before you actually go ahead with some treatment protocols that would be necessary for the lady. While discussing with her, you would definitely suggest some basic things that she should take care of, and exactly how it will help her to manage the current problem. So, can you give us certain tips to our viewers, to our listeners? Are there any sort of things that they should know? How can they manage it? Before actually jumping to a conclusion that they're not able to conceive. I think that would really help them.
Yeah, so basically, when they come, the first thing when we elicit in our histories will always be about, from how long they have been trying. Their married life can be 8 years, 10 years, or 12 years, but they have not even tried for pregnancy in the last 1 year also. So that becomes an important factor. They keep from when they are trying for pregnancy. And in fact, if they are ready for a pregnancy, and from when they're trying for the pregnancy and how often they're trying for the pregnancy. So a lot many times what happens, the couples are either not together, or the main ovulation window that is there, they may not be aware of it, and that is when they skip, they don't realize at what phase of the menstrual cycle they have to try. So a lot of times we see that a lot of couples are not even together in the fertile window. So those are the small factors that we elicit from them, and then try and say, you have to be together, you have to try, and then only we can suggest that if there is a problem or not. So when they have not even tried, they can we not even say that they are an infertile couple. So the main factor there is either it will be a clash of work, or it will be different cities, different towns, or whatever reasons that they have. But when they are ready for a pregnancy, they have to try properly. And once they start trying and then they are not able to conceive, then only we are going to start evaluating for all the other factors.
Great. So now talking about this particular, I mean, you have mentioned that before actually going and seeing a doctor, and before jumping to a particular protocol, you suggest this particular point to the couples. Now, once they have been trying for a period of let's say 3 to 4, 6 months, and after that, I mean, you think that some other steps needs to be, we need to move forward with that. So, are there any basic tests or any basic things that couples should know that something like this would happen with them if they are moving forward with the treatment procedures?
Yeah, so if they have tried with natural intercourse and has not yielded results, say for a period of 6 months, and then we take into the criteria of age of the patient, and then of course her ovarian reserve. These are the two main factors. So provided they are not in the elderly age group and they are ovarian reserve, even if they're elderly, if the reserve is good, and what we do with the baseline scans and we see their egg number is good, so we have an idea about the quality and the quantity. Then, of course, we do the basic hormonal profile. We rule out thyroid dysfunction, we rule out any other hormonal imbalances if they may have. And in case of the male partner, we do a baseline semen analysis and see whether there's no the count and the motility, everything is in the normal values. So if we're sure that all these values are good and they're looking fine and there is no, distinguished pathology in the patient, then we can still wait for about 3 months, provided all the values are normal. Then we do give them of another, 3 to 6 months interval. We may tell them some lifestyle changes, get onto a strict and healthy diet, cut down on junk food, basically to more importantly to eat on time, and think of some relaxation techniques to reduce the stress levels. So the moment there is a lot of stress, the hypothalamus gets affected and non-hormonal dysfunction starts there. So that's when we tell them, pick up some relaxation technique or a passion or a hobby, 30 minutes a day, at least 5 days a week, and try to follow it on a regular basis. And we also check for the the compatibility between the husband and the wife, if they're mentally, if they are sound, and if they are prepared. And we give them more of a positive approach, and the more positive they think about it, it always plays good on their mental well-being, and that will help them to even go through another 3 to 6 months of waiting period. Most of the times we see them in a lot of distress, a lot of frustration, because every month they're checking, every month it is coming negative. So they all think that the moment they try they have to conceive. It doesn't work like that. So a lot of times I tell couples, to relax, you take a break, and stop thinking of that as an end point, stop thinking of that as the game, or or the end aim to achieve. Just try naturally. Most of the times we see a lot of couples who come back within 3 to 6 months with a natural pregnancy. So small changes do help a long way, provided everything else is normal. But if we do pick up some disturbance in any, either the female partner or the male partner, we automatically prefer to treat it first, and then again we can give them a chance to try natural.
Great. Thank you so much, Dr. Sana. Uh, Now, I think we have come to the end of the basic questions that we really wanted to get an answer from you. We Meanwhile, we are getting certain questions in the chat box and in the
Yes,
message box.
correct.
Can we? Okay, so we'll first start with a question from Mr. Devendra. Good evening, doctor. Does obesity lead to infertility?
Yes, obesity definitely, patients who are obese, we do see increased chances of infertility in them. Primarily being that because of the fat deposition, there is some amount of liver dysfunction in these patients, and we see high levels of even androgenic hormones, that is the male hormones, and that is when they come with more tendency for PCO, polycystic ovaries. So in these patients, we see a lot of eggs, a lot of follicles, but they're all premature. and not a single egg is going on to the phase of maturity and becoming the dominant follicle for that cycle. And that is when we have ovulator dysfunction, and these patients take longer times to conceive. We see a lot of insulin resistance in them, and drugs like metformin and all will help in reducing this insulin resistance. Along with that, weight loss plays a very important role. 5 to 10% weight loss can give remarkable results in case of ovulation in these patients. So yes, obesity does play a big role, and most of the times we don't start treatment until the patient has been able to attain some amount of weight loss, and then even after that, drugs will work better and results will also come out faster.
Thank you so much, Dr. Sana, and thanks, Devinder, for your question. I will take up the next question from Mr. Manikanta. Good evening, doctor. My doubt is, does stress due to work tend to infertility, like stress due to mental health?
Yes, definitely. I think that has a bigger role than the physical health these days. See, mental workup of the patient and the partner is assessed when they come in first itself, because that shows how they respond to the situation and how they take the problem at hand. Many times, a lot of patients live in denial, saying that, we are not, I am not infertile, I am going to conceive naturally. A lot of fixed ideas they come up with. And the other factor being maybe the work stress is causing them to be like that, and they fail to see the other part of life, that there is so much more happening, so much more to enjoy, and so much more to pursue. So then we see a lot of disparity between the couple also in these kind of cases. So when the moment we see that, we try to get them both on board, in the same kind of mental setup, so that they're able to understand each other, they're able to understand what the other person's needs are, and then they can think more towards attaining a pregnancy first, and then only think about the stress related to work, because the stress related to work is always going to be there. It is never ending. So where we draw the line is our own decision to make, right? So we counseling is where the big role comes in. We have to counsel almost, however long the patient takes, it is our duty to counsel them first, try them to get onto some relaxation techniques, and then once their mental well-being is good, then try to achieve the pregnancy.
Thank you, Dr. Sana, and thanks, Mani, for your question. Dr. Sana, we have one more question in the message box. It is from Ms. Shubhra. I guess if I can frame the statement this way, she's trying to ask. One of our relative was asked to do a AMH test. What it is and what it says and how much time does it take?
Yeah, so AMH stands for anti-Mullerian hormone. This is the hormone test that we do to know the reserve. How much is the egg reserve in the woman? Now, basically, all women are born with a fixed reserve. Okay, we cannot increase it or try to generate more eggs. It is fixed based on the genetic makeup of the woman. And at puberty, the number of eggs that they are born with comes down, and every month one egg is released in the menstrual cycle. So, as age advances, the ovarian reserve, or the number of eggs that the woman has, always keeps going down. And that is why, when we have to assess for any fertility treatment, AMH we use as a baseline to know what is the status of the woman with respect to the number of eggs. So, we cannot assume that, just because the woman is young, the reserve is going to be good. Just because she is 40, her reserve is not going to be good. It's not like that. We see so many younger women now, 24, 25 years old, with a low ovarian reserve, and equally the other way. So that is why we ask for a ovarian reserve testing, and based on that we can suggest the treatment. If the reserve is good, we can still try with natural intercourse and just give them mild form of monitoring and just tell them about timed intercourse and stuff. But if the patient starts reserve starts falling, then the time they give us to help them to conceive is much lesser. So every month that woman is losing one egg. So, and that is when we have to speed up the treatment. We cannot keep them waiting for long and keep telling them, try naturally, try naturally. It's not going to happen. It can happen in the rarest of rare cases, but on the whole, it is our duty to counsel them that the moment we see a low reserve, we have to step up the treatments.
All right. Thank you so much, Dr. Sahana. And I hope, Shubhra, you are with us and you have got your answer. If you want to know more about it, please do write to us. We'll try to get back to you with more information. Um, Dr. Sahana, we will take up a question from Dr. Ramesh Kumar. Good evening, doctor. For a working woman, is that the sitting position while working also lead to infertility complications?
Well, not exactly sitting position. There have been theories about the heat exposure with working on laptops and electrical equipment, and of course, positions, especially in patients who are in women who are working in maybe where there is exposure to radiation, exposure to a lot of toxic fumes. There is a link to infertility. Posture as such, no. But of course, the posture, continued sitting without exercise, without movement, sedentary lifestyle, those, yes, those are implicated. And that's when we suggest them to get up, take a walk alternatively, and try some exercise every day. Those are the changes we would suggest in such patients. The position as such, no, not really.
Thank you, Dr. Sahana, and thanks, Ramesh. I think we have a question from Kajal asking, how does the stress in working women affects fertility? I think ma'am has answered a lot on that, and she has been constantly talking on that. So, Kajal, I would request if you can just rewind a bit and just see what Dr. Sahana had to say about this. I'll just take one more question, which is in the message box. The name is not so the person wants to, I think, say, they want to ask which is better, IUI or IVF, and success किसका ज्यादा होता है.
Okay, so IUI and IVF both are fertility treatments that we offer. First line in majority of cases is IUI. That, of course, in this patient we don't know what was the causative factor and what is the diagnosis made. IUI we do suggest is the first line because it is cost effective for the patient and we can try multiple cycles. But the success rate is generally does not go beyond 15 to 20% in any cycle for that matter. Whatever drugs, whatever mode of stimulation we use, that is the almost fixed success rate for IUI. And hence, but of course, we can try multiple cycles in most patients. But IVF, of course, with the advances in technology and the precision technology that we have, IVF success rates are much better, ranging somewhere between 45 to about almost 60 to 70%, some centers may offer. So success rate is definitely better with IVF. What the patient needs will be decided best by their doctors.
Correct. Thank you so much, Dr. Sahana. I think for now we have taken a lot of questions, and I really thank our viewers for putting your concerns out here. And I would request everybody who will be watching this video, if you want any more information, you want to ask some more thing to us, do write to us in www.puberty2menopause.com. We would really try our best to get back to you with an appropriate answer. So, Dr. Sahana, I think before we actually wrap up today's such an interesting discussion with you that we had, I would request you to, I mean, it won't be a request. I think I would request you to share certain, I mean, I think instances that you would have heard from your patients. I'm sure when you would ask them to, take up, or let's say, don't stress out much, try to improve your eating habits or get into a physically healthy lifestyle. So I'm sure you would be getting certain responses from the ladies, especially the working women who are professionally very, they're at the peak of their career, and they definitely would be having a lot of certain questions that they would ask to you. Can you share some instances with us, and and also end today's discussion by sharing some very important points that can summarize and can actually give certain points to our viewers?
A lot many times we see, of course, working women who are rising up in their careers, who are so driven that they don't want to take focus off their professional lives, which is okay until the patient knows where they are heading towards. So there are set of women we see very often who say we don't want children, we are very comfortable the way we are, and if they are very sure about it, that is left to them. That is their personal choice. But we do see women who come back at 30, 32 and say we don't want to conceive now. I want to wait 8 years, I want to wait 10 years. So in those set of patients it is little difficult to tell them, okay, yes, you will conceive later, don't worry. It doesn't work like that. A lot of women who are very aware now, who come asking about social egg freezing also. So in these patients also we do tell them that, okay, there is a chance that you can freeze your eggs and you can try to conceive at a later date. But again, success rate will vary, one. And secondly, at that particular age when the woman actually wants to conceive, will she be physically and mentally sound enough to carry forward a pregnancy? So those are small points we'll always discuss with them before they choose to go ahead with egg freezing. A lot of women nowadays who come and ask about that too, because that particular phase, for women, I feel it clashes a lot, irrespective of which field they are in. Where you're rising professionally and here your family life is also calling, and they want to draw the balance out between the two. So it is all about where they choose to draw the line, that's it, and where they how they choose to balance it out. So they have to, as long as their priorities are clear, I think it should be okay. And a lot of women who say no, we want to conceive and then go ahead, in a lot of those patients we tell them to conceive soon. So wherever we see low ovarian reserves, wherever we see that the patient's conceiving chances are much lesser due to many so many other factors, in those are the cases we see you would try and complete one pregnancy and then go ahead and pursue whatever you want, academically or professionally. But all otherwise, if their reserves are okay and they're regular, with their follow-ups, and they're willing to think, they can still try naturally and try to attain the pregnancy. So one on one, I think depending on the patient, we have to individualize and see what their priorities are, what they want to achieve, personally and professionally. Then it's easier for us to guide. And nonetheless, I think for all working women, we somehow get lost in the whole aspect of work and home and work and home. So I think we should start taking care of our own health, start giving attention to your own bodies, try to understand where health is getting upset, or it could be hormonal imbalances, it could be menstrual disorders, irregular cycles. In a lot of women we see coming up with PCO these days. Huge chunk of PCO is linked to stress itself. So a lot of simple lifestyle changes: cut down on alcohol, cut down on smoking, even cut down on caffeine for that matter, and regulate your working hours. Try and fix 30 to 60 minutes a day for yourself, for whatever it is that you enjoy doing. I think that goes a long way, and that helps them to do better professionally and personally if there is some time taken out for themselves. So these small things I would like to share with my audience also today, and start introspecting and start seeing where you're going in life, and see where you want to be and plan accordingly to that.
Great. So kind of you, Dr. Sahana, and I'm sure the words that you have mentioned today, I think it all boils down to ultimately for all the women out there, as Dr. Sahana mentioned, working women is a very vague term. Every woman is working in some or other way. And so I think the entire discussion boils down to one very specific point, that it's high time you all need to take care of yourself first. Do not ignore your health, do not ignore your interest. Do introspect and see what you love and what you can do for yourself first. So I think that will take you a long, long, long way. And do take care of yourself. With this, I really thank Dr. Sahana for joining us today and giving us such wonderful insights, and making this particular topic so interesting to discuss. I had a great time talking to you, Dr. Sahana, today, and I'm sure everybody who will be watching this video and watching us right now feels the same. And it will be forwarded to many, so that many can get the interesting and very factful insights about this particular topic. And thank you so much, Dr. Sahana. And
Thank you so much, Dr. Payal. It was a great pleasure to be talking on something which we all so closely relate to. So I had a good time discussing this. Thank you so much.
thank you so much. And I also thank all our viewers. So this particular show by We Talk Do You was on infertility in working women. And you can share this video with your friends, family, relatives. I'm sure they'll be benefited out of this. And everybody out there, if you want us to bring a particular show on a specific topic that you would think will help you and anybody please do write to us. We'll try our best to organize a We Talk Do You session with the leading expert of our country. With this, I thank everybody and wish you good health. Please do take care of yourself and have a great evening. Thank you so much.
Thank you, Dr. Payal.